Hello, everyone. Welcome back to another session of A Day with your Fertility Specialist. I'm Joanna Damina, your host for today. Thank you so much for joining us. Thank you for your consistent engagement. Every click, every like, every comment, and every share. While on the topic of sharing, please do well to share this with someone that you think will be interested in this topic or someone that just wants to learn more about this. Like we started last week, we're talking about PCOS until the end of this month. So if you have been diagnosed or you know someone that has questions about PCOS, please do well to share this with them so that they can join us. Today, we are going to talk about PCOS and fertility. For that, we have Dr. Kenneth Eguda with us. Hi, sir. Welcome again. If you're joining us for the first time, I will make a brief introduction, even though our regular viewers know who he is already. But Dr. Kenneth Eguda is a consultant gynecologist. He's also an IVF specialist, fertility specialist, minimal access surgeon, and the pioneer of laser surgeries, laser gynecological surgeries in Africa. So you see, we have all hands on deck in one person today to talk about PCOS. So stay tuned to learn a lot more about this. Like I said last week, we have a lot to discuss about PCOS, and if you've had any questions about this, stick around until the end where we get more insight from Dr. Kenneth. Welcome, sir.
Cheers, thank you.
So, thank you for joining us today. Um, we just want to talk a little bit more about PCOS and fertility. Last week we spoke about the symptoms you can present with and how the doctor will help to, or how the doctor will diagnose that and then reassure our patients about this. So can we delve a little deeper into it? We spoke about the menstrual cycle last time, and we know that fertility or pregnancy starts. We have processes into that, and let's talk about ovulation, right? If our viewers are familiar with the word ovulation, trying to get pregnant, you know that this has a lot to do with fertility. So, how does PCOS affect ovulation?
All right, I'll try to make it as simple as possible.
Please do.
Yes, now, you know, an individual with PCO has a lot of tiny little intrafollicular cysts, you know, on both ovaries, and then this cysts secretes lots of estrogens. A lot of estrogens. They're not like the regular seeds that grow so big that women talk about. Talk about when they say they have ovarian cyst. This is not that kind of ovarian cyst.
Okay.
We're talking about the pear-like arrangement of small cysts, like structures on the ovaries. You know, these produce lots of estrogen. You know, and when you produce lots of estrogen, it tricks the brain that already some eggs are developing some places,
Okay.
and so the brain just goes quiet, feeling that that eggs are already been produced, and so she goes without ovulating, you know. And then for those who manage to strike some ovulation, they have very high level of luteinizing hormone LH, and because of this affects the quality of eggs that they produce and makes the quality of eggs a little bit poor.
Okay.
So even when they manage to ovulate, sometimes the eggs are so poor that may not result in any meaningful thing, you know. And that is why usually a lot of people, especially the laymen, call it hormonal imbalance.
Yeah,
So the
yeah.
hormones
Super
are
normal.
so out of order that it just causes anarchy in the axis where egg development, ovulation happens. Okay, so they have so much estrogen, so much luteinizing hormone, and this causes a lot of anarchy. And then because they have this so much estrogen too, the body it stays the lining of the womb
Okay.
and just keeps growing it, and then it can grow it for up to 3 months,
Wow.
and then while it's growing it, you know, menstruation doesn't happen. And then after a while, the lining of the womb been grown can now break down, and then they have very funny pattern of ovulation. Of menstruation. Some would start having as spotting,
Yeah.
then it becomes bleeding, and then for sometimes it now bleeds for a very long time, and even to the point of causing emergency for some people, to the point that they may even be requiring some form of assistance, either with blood medication or with blood transfusion itself. So it caused a lot of anarchy, and then because of that, it disturbs the process of ovulation, and then it affects the quality of eggs that they produce. And then this is just how simple I can say how it affects. That is how it affects ovulation. It treats the brain that ovulation has happened already. Why do you have to put through the signal for ovulation? You see, because for ovulation to happen, the brain sends some signal to the ovaries. The brain produces what we call follicle stimulating hormone.
Yes.
Then the follicle stimulating hormone triggers the follicles to develop and grow and be producing estrogen as they are growing, and thickens the lining of the womb. But you see, in PCOS, you have a lot of tiny follicles that produce a lot of estrogen. So it just tricks the process. And so ovulation doesn't just happen for some of them.
Okay.
But it's good for us to mention that this is not, this doesn't necessarily happen with all patient or clients who have PCO, because PCO is in grades. There are like 4 grades of PCO.
Okay.
And then for scientific reason, maybe we'll say there are 4 phenotypes. Phenotypes A, phenotypes B, C, and D. A and B are mild form. C and D are the bad guys, PCO. So the people with this C and D could actually go a very long period without being living like as women. Then A, B could just be normal. So you could be PCO and not be normal, be producing your eggs, having babies, and all of that without any issues.
Okay.
All right. So that's how it affects ovulation for some people, but it doesn't necessarily affect ovulation for everybody.
Okay.
Yeah. So it makes ovulation erratic. It makes ovulation unpredictable. And then for some people, it makes ovulation not to happen. And it's good to mention at this point, there are some people with PCO that don't ovulate at all.
I was going to ask that just now. I was going to say, is it that it's a complete lack of ovulation or just it's being irregular?
It's a spectrum. Some people don't just ovulate. High grades of PCO.
So the C and D, the bad guys.
They just as a bad PCO. They are good guys.
Okay, so for people that don't ovulate at all in PCOS, are there medications? Are there things that you can do to induce that ovulation or to bring about ovulation?
Usually, when they see a doctor, it's good for the doctor to evaluate and kind of classify them into the kinds of PCO that they have. A common thing with a good number of us gynecologists is that you just place them on all kinds of medication. Then the common one is the clomid and the clomiphene citrate, and the letrozole.
Okay.
These are medications that you give them to trigger ovulation,
Okay.
or to kickstart the process of growing egg to the point of ovulation. So when you give these medications, some people would ovulate, but some people may not ovulate. So, but it's good to triage them to understand the kind of PCO they have. Then you can define the means and processes to push them towards ovulation. There are some that will not respond to the regular medications you give. Then you're going to have to give higher level of medications.
Okay.
And there are some that lifestyle changes could just help for them to ovulate. And there are some that you have to do some surgical procedures before they can ovulate.
Okay.
So you have to understand what kind of PCO this lady has. and then decide how to help her. But it's good to mention that it's good to start from the low the lower form of intervention, then you get to the advanced form of intervention.
Okay.
Yeah.
So does this matter every grade, like from the A to D? Do you always start from the lowest form of intervention?
Now it depends on all kinds. You know, I could remember that I just finished a procedure for treatment for PCO before. I mean, this is how I dressed for the procedure. As
Yeah,
a matter of
yeah.
fact, a lady who had not been pregnant for 5 years of marriage,
Mm.
and then she's seen all kinds of people before coming to see us,
Mhm.
and just looking at her history, evaluation, investigations were just high level. I mean, PCO, advanced grade, CD level.
Wow.
And again, she has had medications, the regular medications, for pregnancy treatment, and nothing has happened.
Mm.
And then referral to us, because we are a referral center, a referral to us is just, hey, Ken, you guys should make this woman pregnant. So at that point, we would not want to start from the basic level, because the other guys have done the basic
Okay.
things. So you just go to the advanced stage.
Mm-hmm.
And of course, and since they're already looking for possibility of having an IVF, we just went straight to laparoscopic ovarian drilling.
Sounds interesting.
Yes, because the PCO ovary has a lot of what we call fibrous tissue,
Mm-hmm.
the stroma, fibrous stroma on it. And these are all the things that cause the abnormalities with release of eggs
Okay.
and the hormone profiling. And then it also causes abnormalities with menstruation. So now the goal for IVF, for instance, is to get good eggs from the woman and get good sperm from the man, and also be sure that the lining of the womb is good enough for implantation to happen. So our goal is not just to get egg, but good egg. So we have to optimize the body of this woman. So in that case, we needed to do laparoscopic ovarian drilling, because she met the criteria for that, and so hormones will be controlled, and that the environment for growing of eggs will be improved. And then usually with this, some people just ovulate by themselves and even get pregnant without even needing to do IVF.
Okay.
And so this is an advanced level of care.
Yes, I would
So you
actually
don't have to go from the
lowest.
lower level to the high level. It all depends on who you're dealing with, how long she has tried getting pregnant, what other interventions she had before, and all of that. But if it's a woman who is just maybe newly married, or who has not been trying for a baby and just started trying, and then she menstruates every month, and ultrasound was a bit friendly to see, to look, you could just start with ovulation induction. I mean, giving tablets
Those
for her to
medications,
ovulate.
yeah.
Of course, if she's on the big side, obese, you want also to shed weight, because shedding of weight will help control estrogen and will help ovulation to also happen.
True. If you remember last week, we spoke about that with Dr. Jane. She told us about how even just a little weight reduction, like 5% of reduction
Yeah,
in weight, can actually improve your chances of getting pregnant, even with PCOS.
exactly,
Yes. So those
exactly.
lifestyle changes are very important for that. But I actually want to talk to you about something that you mentioned that sounds so interesting: ovarian drilling. I mean, it sounds mechanical. It sounds like
Like fire drill, right?
yeah, like a construction kind of thing. What exactly is that, and how does it improve the chances of a woman with PCOS getting pregnant?
Okay, so you see, if you understand the pathology problem that PCO causes, PCO first of all affects the quality of eggs negatively, and then lowers your chances of getting fertilization and implantation. And then because of the hormone abnormalities, you have problem with frequent miscarriages for some people, and then you also have problem of not even producing eggs at all. So the problem spectrum of PCO is quite wide.
Yeah.
Then we are not even talking about yet about the metabolic problem, the insulin resistance, and then the other hypertension risks and all of that. So when you do ovarian drill, it's the most advanced care for PCO people, because when you do ovarian drill, the energy source that is used, whether it's a laser or the diatomy or the monopolar, it burns the stroma of the, because I had mentioned earlier that the ovaries of those having PCO, if you felt it before, it's usually thicker than the regular lady's own, and sometimes they are bigger because of those thick fibrous tissues they have. So the process of drilling burns off those fibrous tissue, yes, and soften the environment for easy release of eggs. And these fibrous tissues are some of the guys that are also responsible for the elevation of estrogen and the elevation of the LH. So that this just one single procedure controls all of this. So it helps with regularization of the menstrual cycle, improving ovulation frequency and rhythm, improves the quality of eggs, and reduce your risk of having miscarriages. Just one procedure doing these mega things. So that's how it helps. And I think it's very beneficial. And then when you have it done, then you've also lessened the burden of medications, because it will take the place of all the medications you need to be taking. So that's how it works. So you just make some holes on the ovaries under the ultrasound and laparoscopy, through the laparoscope, and then the woman goes home, and if she gets pregnant spontaneously, praise the Lord. And if she needs to do IVF, then of course she goes for IVF. At least you've improved her chance of producing improved quality of eggs and reduce her chance of having miscarriages. So that's how it works.
Okay. So yes.
So we do that a lot.
I actually was going to ask about that.
We do that a lot.
About how the treatment for PCOS, like this, you said it's the most advanced, and how that helps with artificial reproductive technologies like IVF. Or
so what it does is, in IVF you need good eggs. So when you do that, it improves your chance of producing good eggs. But of course, you see, you may need to give some adjuvant therapy, like vitamin D. If you check that the woman is low on vitamin D, you could do that. Coenzyme Q10, what ladies call CoQ10 or something. You could do that. Then the myoinositol, which is one of the substance for the metabolism that these guys need. All of this could be given alongside. Then there are a good group of people that are deficient on homocysteine. You could also give homocysteine. If you do an assay and find out that homocysteine is low, you could give all of these help in the metabolism and growing of eggs, and enhancing your chances of getting pregnant for people with PCO.
So, but does it always require a medical treatment to increase chances of getting pregnant? I mean, does someone with PCOS always have to go and have let me not say go and have a meeting with the doctor, but do something like an ovarian dream? Like you said, that's the most advanced. So it has to be, let's say, a C or D level So, but for, let's say, A or B, do they always have to?
No, it's not everyone that needs that. Okay, it's not everyone that needs that. There are those with PCO that don't even know they have PCO.
Yeah, true.
Life just goes smooth for them.
Yes, we've seen that a lot of women that have PCOS have not even been diagnosed.
They've not been diagnosed, and then everything is fine. They have all the kits they need to have. Menstrual flow or menstrual conditions are just normal, and all of that. So it's not everyone that needs that. So some don't need any intervention, some needs medication, but the categories of people we see visiting the gynecologist a lot are those with problems with conception. So PCO is the highest cause of hormonal abnormality leading to infertility or subfertility in women of reproductive age group. So they have a lot of visits to the doctor because of pregnancy related matters, and a good number of, and then the next category is because of menstrual abnormalities.
So can they have early diagnosis? Can a woman with PCOS have see a doctor? Let's say when they have those signs and symptoms that we spoke about last week. If you're just joining us for the first time today, do well to watch our previous session. We spoke about some of these signs and symptoms and causes. So if they have those things and they're concerned and they meet a gynecologist about that, is there a way to diagnose early before it progresses, or does it always progress? Let me even start from that.
Oh, wow. So now, talking about progression, it's going to be a very difficult one for me to deal with because,
Okay.
PCO doesn't have a cure.
Okay. Yeah.
It doesn't have a cure. It's just a lifelong metabolic or hormonal abnormality that a woman will have to live with. But if you talk about it getting worse, I would say, okay, yes, it's possible it get worse because when a woman has it and then she adds weight, it get worse
Okay.
and makes the prospect of reproduction and fertility a little difficult. So yes, in that case, it can get worse, but it doesn't have a cure. You understand? You could only play around it, manage it, and improve the lot of the woman. And you treat the symptoms or condition that she asks for.
Yeah.
If it's bleeding abnormality, you treat it. If it is pregnancy related issues, you deal with it. If it's acne, pimple, what they call pimple, you treat it.
Yeah.
If it's obesity, you watch, treat the weight. If you want to do surgery, if you want to do exercise, if you want to do liposuction or gastric
Gastric sleeve.
bypass
Yeah.
surgery, you could do all of that just to watch weight. So yeah, so that's what PCO is. You don't have to treat all, but it can be diagnosed early, just as you said. Yeah, and one of the earliest, the younger age I've seen PCO is about a 14-year-old girl.
Oh wow.
Yeah, I started menses early, but menses were just haphazard, and they're very chaotic, and just all PCO, very crazy kind of PCO. So when you see those kind of age group with PCO, you just counsel them to know what life looks like ahead of them
Yeah.
and what their fertility prospects will be. And for this category of people, it will do them good actually to to should I say to get pregnant early if it's possible. Yeah,
Yeah.
you know, get pregnant early if it's possible. Start trying early
Okay.
because there's a group of people with PCO that their symptomatology are little better when they are
When you're
younger.
younger. Okay.
And as they get older, the symptomatology gets complicated, and then all hell breaks loose at that point in time. So you see, some have all their kids, and so you don't worry about all of that when you're
Yeah.
advancing it. So this is just what it is. So it's neither here nor there.
Okay, well, that's fair enough. But just like most, or should I say, other medical conditions, or you know, whoever it is out there, we've seen people try to heal things with natural remedies and herbal things and supplements and things like that. How can you say that affects a woman with PCOS? Does it really affect the condition itself, or any other thing generally in the body?
The natural remedies.
Yeah, I mean those, yeah, natural remedies, or should I say supplements and
Yeah, there are supplements we know that improve um, insulin sensitivity.
okay.
Yes, and I won't brag about knowing so much about this now because I've seen people talk about the turmeric and some of this stuff
Yeah.
that they improve our insulin sensitivity. I have no scientific backings for all of this, but if that does, then that's great.
Okay.
Yes. So I know the natural remedy drugs or medications or interventions do work, but I have very reduced knowledge in this
About it.
aspect.
Okay.
So I'm sure they do work. Coenzyme Q10, for instance, is a supplement. Myoinositol, it's also a supplement. Homocysteine is a supplement. And I would like to classify them as natural remedies,
Okay.
even though they have been tried and proven with a lot of scientific researches, and their benefits have been documented in the literatures and papers. So
Okay.
these actually
We
do
have
work.
scientific
But
evidence.
the real diets, like you want to do some keto, if you want to do keto dieting, if you're on the big side, that can actually help too.
Okay.
Because weight loss just has a way of helping with polycystic ovary. So I would say yes, the natural remedy helps, but do it under the care of somebody who is grounded
Mm-hmm.
with natural remedy advices.
Okay, that's true. I mean, for everything that you're trying to work on, it's best to have someone that knows what they're doing or someone who is certified in what they're doing so that you don't end up making things or aggravating things or causing more issues in other, parts of your life
Exactly,
or your
exactly.
body in general. So just make sure that you have someone that is guided in, these things that you want to add into your life, those natural remedies and all that. And then we have people with PCOS that are aware that they have PCOS and are struggling, let's say, with their family and friends or people that know about it. How
That specialists who handle that. There are sometimes for PCO you need to see a dermatologist, which has a skin specialist.
yeah.
Sometimes we have to see the endocrinology, which is an internist physician. Sometimes you need to see the surgeon. Sometimes you need to see the gynecologist. Sometimes you need to see the reproductive endocrinologist. So all of that. So it's good to know that there are different specialists that cares for polycystic ovary, depending on the problems the PCO is posing at that point in time. So people should reach out and take advantage of the knowledge of these specialists and improve on their life conditions through these medical experts. And when it gets to requiring IVF, of course, a good number of people with PCO will need an IVF,
Mhm.
and painfully IVF with egg donation.
Oh, okay.
Yes, PCO people are among the difficult group of people to treat in IVF using their own eggs. Often the eggs are not good.
Quality.
You know, often the eggs don't even fertilize. Well, the,
Mm.
the irony is that they produce plenty eggs,
Oh.
very plenty eggs. But then because of their peculiarities, the eggs may just not be in great condition. It's very tricky dealing with them. Just as good as it sounds.
I mean, yes, we've spoken about some of these limitations to achieving fertility with PCOS, like the quality of the eggs, ovulation, irregular ovulation, or the lack thereof of ovulation. And I hope you have more information about these, should I say, symptoms that present or this condition. Dr. Ken, do you have any advice for a woman struggling with PCOS, a woman that has been diagnosed with PCOS that wants to have children in the future or even at the moment?
Yeah, my advice would be if it's related to fertility, they
Mm-hmm.
should see the experts and have a very in-depth evaluation, and then the pathway to fertility would be discussed with them by the experts. So that's going to be my
Your
advice.
advice?
And of course, young kids that are growing up, I mean, in this dispensation, that eat a lot of abnormal diet, you know, diet that have lots of estrogen. Yes, I mean diet that have lots of estrogens need guidance
Mm-hmm.
from either their school authorities, from their parents, or from gynecologists to cut down on some of this kind of diets, because it predisposes them to having PCO like
recap of what we spoke about last week and the treatment that your doctor might work out for you if you have PCOS or if you present to PCOS, especially if you're trying to get pregnant, like ovarian drilling. That's for the advanced guys, the bad guys. And then we have the medications, that you can get, and the lifestyle changes that you will also need to make as a woman with PCOS. And yeah, we'll just have another round of saying thank you to Dr. Ken for your professional insights on this topic. I hope you have learned from today's session. I hope you're leaving with more information and, less worry on your mind because, like he has said, like Dr. Ken has said, we can manage PCOS, manage your symptoms that you present with, and you can have a very good. It's never too late to learn more. It's never too late to have more information on whatever it is that is on your mind, or you just want to learn, you're interested, you're curious about this PCOS that you hear people talking about. So do well to tune in Friday, 3 p.m. Have a lovely day. Bye.